growth hormone to overcome genetic limits and achieve both hypertrophy and hyperplasia of skeletal muscles. There is at least one more function of human growth hormone that we need to discuss. And this function is truly unique and incredible. Skeletal muscles consist of myofibers, neurons, and vascular network, and of course connective tissue, of which the structural and functional elements of skeletal muscles are formed and known as myofiber. Each myofiber is anchored at its extremities to tendons and tendon-like fascia at the myotendinous junctions. Myofibers are composed of actin and myosin myofibrils, repeated as a sarcomere, which is the basic functional unit of the skeletal muscle. Responding to the signals from motor neurons, myofibers they depolarize and release calcium from the sarcoplasmatic reticulum. This drives the movement of actin and myosin filaments relative to one another and leads to sarcomere shortening and ultimately muscle contraction. Mammalian skeletal muscle, including human skeletal muscles, during adulthood is a stable post-mitotic tissue with infrequent turnover of myonuclei. In other words, simply speaking, the number of myofibers is fixed and genetically predisposed. It is possible to cause muscle hypertrophy, which means that the myofibers increase in size, but not the quantity of myofibers. For instance, we observed that phenomenon of hypertrophy happening due to resistance training with progressive muscle overload in bodybuilders and weightlifters. In contrast, severe muscle injuries due to either traumatic lesions, for instance due to extensive physical activity such as resistance training, are accompanied by myofiber necrosis, inflammatory responses, activation of satellite stem cells, proliferation and differentiation of satellite cell-derived myoblasts. This process, starting from myofiber necrosis and ending with new myofiber formation, is called muscle regeneration. Growth hormone directly and preferentially induces the mechanogrowth factor that leads to the activation of the muscle satellite cells. These muscle satellite cells act as a sort of a patch on the site of the myofibril damage, repair it, and subsequently create both hypertrophic effects, increase in size, and hyperplastic effect, increasing a number of myofibrils. In a nutshell, this is the only possible mechanism to overcome genetic limits and achieve both hypertrophy and hyperplasia of skeletal muscles. And this topic acquires extreme importance not only in athletes and sports medicine, but also in anti-aging medicine in treatment of sarcopenia and frailty syndrome.